Hello and welcome back. It's Dr. Ruth here again. So today I'll be going the public health route, which is basically disease prevention and health promotion. And today I'll be talking about the silent killer. In recent times, I want to believe that many of us know or have heard about someone who slumped and died, or someone who slumped was taken to the hospital and didn't make it. And by now, I want to believe you know where I'm headed with this. The silent killer we are talking about here is hypertension. Now, it is called a silent killer because often than not, there are no symptoms. People don't present with symptoms. It's either the person slumps or they have a stroke, then they are taken to the hospital and it's discovered that it was as a result of hypertension. So what exactly is hypertension? In very simple terms, hypertension is that there is an increase in the pressure with which blood passes through our blood vessels. So normally the heart will pump blood and then there are bigger vessels from the heart, and as it goes down the body, the vessels will decrease in size. So imagine you have a hose, like your water hose, and you are passing water through it. Sometimes the water comes with so much pressure and sometimes it is less pressure. So basically it is the pressure with which blood passes through the vessels, and hypertension is said to be blood pressure of 140 systolic and 90 diastolic or greater. The number of people living with hypertension or taking medication for hypertension has doubled between the year 1990 to 2019, and it is said to have risen from 650 million to 1.3 billion people. You can imagine the rise, you can imagine the numbers. And unfortunately, nearly half of these people are currently unaware of their condition. According to WHO, 1.28 billion adults aged between 30 to 79 years are living with hypertension, and of course, two-thirds of these adults are living in low and middle income countries, and we know where Nigeria falls in. Nigeria is a low income country, so you can imagine these numbers they are talking about are equally the same experience in Nigeria. And less than half of these adults, that is 42%, are diagnosed and treated, meaning the remaining 58% are undiagnosed and untreated. It also says that 1 in 5 adults have hypertension have it under control. What does that tell you? That the remaining 4 do not have it under control, and the consequences are grave. Coming back home to Nigeria, several studies have also shown a rise in the incidence of hypertension. In 1995, an age-adjusted prevalence of hypertension showed 8.6% of people that were 20 years and above living with hypertension, which represented 4.3 million people. That was as at 1995. Whereas in 2020, the same age-adjusted prevalence showed an increase to 32.5%, which represented 27.5 million people. That is a very high number. Imagine 27.5 million people living with hypertension, and we are talking about in 2020. So imagine what it is now that it is 2025. As I mentioned earlier, most people are asymptomatic, meaning they do not have any symptoms, but I'll just mention a few symptoms that are seen in people who actually show symptoms. So it's mostly like headache. Most people will present with very severe headaches. They are going to have blurry vision, dizziness. It can be nausea and vomiting, breathlessness. The symptoms really vary, and that is why the most important thing is to regularly check your blood pressure. more than anything, because you may fall among the asymptomatic ones. You see people come to the hospital, their blood pressures are checked and they're having blood pressure of over 200 and they are walking. They brought themselves to the hospital, they weren't dizzy, they didn't know until it was checked. So more than anything is to regularly check your blood pressure. Also, there are risk factors for hypertension. So they are divided into the modifiable and non-modifiable risk factors. So the non-modifiable risk factors are things that you can't help the situation. It's not as a result of anything you did, and that is why you are at risk. Take for instance, age. Unfortunately, with older ages, hypertension tends to be more prevalent, and sometimes it's simply because the older you grow, the more inelastic your vessels become. So you can imagine the pressure with which blood will pass through those vessels. Genetics. Some people unfortunately have genes that predispose them to hypertension. Also, family history. You hear it being said, one of the commonest questions asked is there anyone in your family with hypertension? So if there is, there's also the likelihood of coming down with hypertension. Also, race. Hypertension is said to be higher in the black race, and sex also said to be higher in men, but after menopause the prevalence rate equals same basically between men and women. Whereas the modifiable risk factors are risk factors, as the name implies, that you can modify, so you can do something about them. So like our diet, what kind of diet do you eat? Is it high fat diet? Is it high carbohydrate? Then also tobacco use is also a risk factor. Excessive alcohol consumption is a risk factor. Also, the kind of lifestyle you live, like are you a sedentary person? So inactivity, lack of physical activity is a risk factor. Obesity is also a risk factor. And high salt diets. I'm sure a lot of us are conversant with this because most times people are told to reduce the salt in their diet. So yes, high salt diet, and all of these are things that we can change from what we can see. But for the non-modifiable risk factors, we can see that they are not things that you brought upon yourselves, neither are they things you can necessarily change. You cannot change your race, neither can you change your sex, neither can you change your genetics per se. So having said all this, I'm sure the question running in your minds are, so what do we do? First and foremost, what I would advise is a regular check on your blood pressure, because I told you it may come without symptoms, and some people, this is what has saved them. Because of the regular checks, they just randomly check their blood pressures once in a while, and then they notice it's high and they see a doctor. So the first and most important thing is the regular checks for of the blood pressure. Then secondly is lifestyle modification, and lifestyle modification is basically modifying those modifiable risk factors. I had mentioned them. So if you are taking excessive alcohol, it means you should cut down or completely stop the intake of alcohol. If it is your diet, I'm going to be talking about the DASH diet in my next video. And DASH diet basically is a dietary modification to stop hypertension. It's sort of a preventive thing to stop hypertension using diets. If you are the one who is inactive, it means you should get active. It doesn't have to be going to the gym, doing strenuous exercises, but have one or two exercise routines you do, or you don't just sit in a place. If you work in an office, you make sure that once in a while you take walks, and then sometimes you trek, going to wherever you are going to. You don't have to take a bike, a car, or a tricycle. Also, if you consume a lot of salt in your diet, I know a lot of people like tasty meals, so but for your own health, there's nothing better than health. It is said that health is wealth. And then stress. Yes, so stress is also a modifiable risk factor. The more you stress yourself, the more you are at risk. So you should also cut down on stress. And I'm saying all this because trust me, you don't want a hypertensive emergency in the current healthcare system we have. The state of our healthcare, I mean, we know how it is in Nigeria. So you don't want to have a hypertensive emergency, because imagine it happens to you somewhere where you slump. Everybody is looking around, looking at you, bringing out their phones, trying to record you talking. And sometimes these things are just a matter of minutes that you need help to stay alive. And before these people, I mean, they are just gathered there doing whatever they are doing, and before you know it, you are gone. Or is it when they even try to take you to the hospital? Sometimes the hospitals are far from where you are, so before you get to the hospital, you may not make it. Or is it when you get to the hospital and sometimes, as ridiculous as it may sound, things you need to combat emergencies are not present? That's why I said, with the current state of our health care system in Nigeria, you don't want to be in this position. So more than anything, that is why I said I came with the public health approach today, which is disease prevention and health promotion. Basically, all I'm trying to say to us here today is that prevent hypertension. Prevent yourself being in a situation where it cannot be helped. Don't wait until it is a stroke. Don't wait until you slump. Don't wait until things get bad, basically. And I know it is common with us Nigerians who want to forbid it and say, oh, it cannot happen to me. But unfortunately, it can happen to any of us. Nobody prays for it, but it happens. The people it happened to, I want to believe that most of us have people that are very close to us that these things have happened to, or we have heard about. So I plead with us to take care of our health. Ensure that you do a routine check on your blood pressure once in a while. Try to know what it is. As I stated earlier, in my next video, I'm going to be talking about the DASH diet. Since most of us are into the wellness, everybody wants to eat healthy, we want to stay healthy, we want to exercise, and we want to prevent hypertension and other diseases. So the DASH diet is very important. It's straightforward, but anyways, I will talk about it briefly so that we have a hang of it. So if you enjoyed this video, please share this video, because it's not just for you. Let others know and be aware. Share this video, it will help save someone. And please subscribe to my channel to have more of this. Till I come your way next time. Bye for now, and thank you.